My name is Pureza Iv, and I'm in Ms. Beman's Adult Health 1 class. And today we're going to learn how to do a basic IV start. Okay. First thing we're going to want to do is implement your standard protocol. Every hospital will have one. So depending on where you're working or where you're doing clinicals, that's what you're going to check. Standard protocol for the hospital where you're at. We're going to assess the type, duration of the IV therapy as ordered by the physician. You want to assess any lab data, client history of allergies, MMR, and again, when we go into the room, we want to ask the patient any allergies, especially if they have allergies to any of the equipment we're going to use for the IV start. They could be allergic to alcohol. You could use the chloroprep instead. If they have adhesive allergies, then we could potentially get a different type of tape to secure it. So I'm going to cut the tape. Have some extra tape right here. It's good practice to have it ready to go. Once I check all of my information, it's going to help me determine the size of the IV pump that we're going to use. Part of what's going to determine that is the patient lab values, whether you're seeing what type of fluids, how fastly will they have to be administered, any antibiotic therapy, blood infusions, special procedures a patient will be going through for testing. You want to be sure to have all that information prior to starting an IV line. It will possibly prevent me from having to do another one. Now, when I go into the patient's room, I'm going to wash my hands in the room because I'm going to start opening my equipment. We're going to start with the IV start kit. Contains your gloves, your Tegaderm, your tourniquet, your chloroprep, and have a couple alcohol swab pads to use to clean the site. We're going to have our kit for an extension kit. Basically, we're going to assume all packages are closed, but we know we're going to work with, so bear with me. This is our extension kit. These on the end are a needle system that's a lure lock. I'm going to go ahead and prime my line. So I'm going to get my needle out of my package and I'm going to connect it to a 10 cc syringe and put them together and twist. It's secure at that point. I'm going to take that off. I'm going to draw down 6 ml of water.
Let's check the pH. Oh, that looks great.
I'm going to clean the top of my bottle because it is good for multiple uses sometimes. So we don't know that it's just for that patient, so let's just go ahead and clean that. We're going to inject the air. I'm going to put it on the table here. Prevent. I'm going to put it in the air. Tip your bottle over. And you're going to see that it starts to fill with the saline. Now, we're going to be able to select the band for different ways. There are certain things we're going to look for. We're going to try to avoid tattoos, try to avoid any scar tissue if the patient has any scar tissue on them.
And I hear some gurgling, I hear some air, so
important things you want to know is you want to know that you have a good vein, that's the diameter is thick enough to hold a cap, and then thick enough also, long enough, straight enough, so you can thread your valve off the needle without puncturing the vein and coming through the other side. Once we go into the patient room, we've got our stuff here set up. I'm going to remove the needle off my saline. I've got my extension kit here. I'm going to prime my line with 3 cc's of fluid so that we're ready to flush once we have the line. So we're going to fill that. Once we've primed our line, we're going to set that next to us.
Even though it doesn't do anything,
Okay.
it just covers the button.
I'm going to go ahead and I'm going to introduce myself to the patient. We're going to want to ask for 2 patient identifiers. Look at your wristband, compare it to the mark, ask the patient for name, date of birth. It also helps you assess their level of consciousness at that point. I would ask my patient if they've had an IV, if they have any medication allergies, if they have any allergies to the aseptic solutions that we're going to use to clean the site. If the patient says no, then we can proceed. We're going to ask the patient if they've had any fistulas, if they have any shunts for dialysis, PICC lines, if they've ever had a mastectomy, if it's a female, on either side. If so, that's going to eliminate one of our sites to look for veins. If not, and all is well, we can proceed. Now, we're going to ask the patient at that point if they have a preference. And if they do, then we try to accommodate the patient. If they do not, we're going to just go for primarily the non-dominant arm so they have free range for the other one. So in this case, my patient has no shunts, no PICC lines, no fistulas, no tattoos, no scar tissue, so we're good to go. I'm going to take and let my patient know what I'm doing at all times. I'm going to take the tourniquet and you're going to tie the tourniquet tight, not too tight, but let the patient know that they're going to have the sensation. Sometimes with the hospital gown, I try to use it under the tourniquet, just because, especially your elderly patients, their skin is pretty tender. You're going to want the limb to be in a dependent position so the blood starts to pool in the veins. They become engorged quickly. And then we're going to look, okay? We're going to look for a good vein. It's straight enough to take a count. It's not curved. It's not too short.
Oh yeah, I guess you can.
And this patient has a great one here, right here in the forearm. So we're going to go for that one. Alright, so I'm going to take my alcohol swab because my patient has no allergies.
And check the pH again. What do we have? Oh, the pH is 3.5.
And I'm going to clean this up.
I didn't see that.
Jess, you having this?
You want to go out in circular motions about 2 inches. Make sure you don't blow on it, don't retouch the area. Go ahead and keep an eye on your site. My hands are washed and clean, but now I'm going to put on gloves.
Sharing is caring.
I'm going to let this loose while I get my gloves on.
No flushing. It's just later whenever we're checking. And 30 ml.
And such. I'm going to come back to the patient's arm. We're going to retie the tourniquet.
But in the meantime, it usually has a cap over it. So how are you?
Making sure not to bring this all the way through. We want a quick release once you've gotten blood and blood return. I'm going to take the needle out.
Okay.
We're going to be using a 28, which are pink.
Flush the 30 milliliters of the
Ensure that you'll learn all the colors. You're going to hold below your IV site. You're going to pull the skin down taut, keeping your hand out of the way, preventing rolling veins, and pulling the skin taut helps the patient reduce pain. Once we're in, we're going to count. We're going to push our vein through. We're going to release the tourniquet. We're going to apply pressure. Our IV extension tape.
I practice also watching you guys. You know what I mean?
At that point, make sure the little cap, the lock, is open before you attempt to flush your line. Dry the area, slightly aspirate, and you're going to see, I don't know if you can see it, but you have the blood return, which means you're directly in the vein. Once you know that you're in the vein, you've got a good run. We're going to flush the line to ensure that it flows. We're not sending any blanching around the IV site. And once we push the fluid, the patient may or may not say that they smell or taste the salt water, which is fine. Typically, normal, it dissipates. Once we flush our line, looks good. We're going to take our tape and we're going to secure our line. We're going to secure the portion first, removing your clamp out of the way. We're going to secure this. We're going to say it's secure because we only have one. And we're not going to cover the lure lock, which is a needleless system where we'll be pushing IV medications, fluids, stuff like that. So if you cover that, you're going to have to redo it.
I need to.
We're gonna grab our tape, and we're gonna tape this up here, above,
Like if somebody
above
else
the
is like,
clamp,
yeah, let's practice our will, but
and above
like,
the
if
IV
I'm not
side.
pushed, I'm not pushed.
Once that's secure, we're gonna put the date, the time, our initials, the IV cap, the signs, how many attempts it took
So the
to
thing is, the video
get there,
There's no way to put things on it.
and then we're good to go. We're gonna fill it, leave it, we're gonna clean up the area around the patient, and that's our basic IV stuff.